Dear friends, I'm Dr. P.P. Bose. I'm a senior consultant pulmonologist. I'm the founder of Science Foundation. I'm a senior consultant at National Heart Institute, Woolchand and Fortis Hospital. Many of you may be following my blogs and websites. And what I'm here to tell you all about that this Omicron is not a scary thing at all. When the initial Omicron news came to us, we are a little concerned, thinking that these mutations can create an havoc in the society. But I was quite sure that when the virus comes this way, it cannot be dangerous because the property of a virus is to stay in the mankind. Initial COVID viruses were lethal because the mankind didn't have much of memory about this virus. When the vaccination has set in and the virus has created a lot of herd immunity, this virus gets mellowed down, and this is a virus. My experience says with more than 500 patients, they are very mild to moderate. None of my patients have dropped their oxygenation. In fact, I don't check the oxygenation of the patients at all. So, my dear friends, I call this Omicron as a vaccine virus. It's a blessing in disguise because if you have a little mild cough, sputum, throat irritation, a little feverish feeling, you're blessed in the sense because this can act as a third vaccine. So that's why I call it a vaccine virus, because it's so mild in its property that you develop enough immunity. So my dear friends, don't get panicky. Don't run for your booster dose because this Omicron is acting as a booster dose. I think 90% of the society has already been infected. It is a highly infectious virus. But since it is infectious, it's not lethal. And even although epidemiologists also will agree with you that whenever the virus comes here, this is how it treats the mankind. Initially, it will be lethal, then it is sublethal, and finally gets mixed up with the society. It's a very mild virus, and it is required to get protected from the COVID. If you have got Omicron, so you're blessed because you have developed enough of antibody. So my dear friends, don't get perturbed by this virus. These are usually mild and moderate. Only thing is that people, those who have high level of comorbidity of extremes of age, or those who are on immune suppressant, they will be a little careful. So there are a few pointers I must tell you that this virus is infectious. It's mild, but it's inflammatory. Most of the time it stays in the upper throat. So if you have the symptoms of cough and cold and little feverish, start doing a lot of steaming, gargling. Nasal wash is a very good technique. The Jalneti is a very good way of cleansing the upper throat. Iodine gargle helps a lot. So my take to all my patients is that I do a lot of steaming, a lot of gargling, a lot of nasal wash, use nasal saline mist. These are all helpful. Number 2, use some anti-inflammatory to reduce the inflammation of the throat. You can use some NSAIDs anti-inflammatory, or you can use some Montelukast levocetirizine. That's useful. Local licorice or moletti is quite useful because it's a very powerful anti-inflammatory agent. It can be very useful to reduce the inflammation of the throat. Truly speaking, one doesn't need any high-dose antibiotic, any antiviral, or any kind of specific drug. No cocktail treatment, which people are getting carried away by many people. But one thing for sure is that if you have the following symptoms in the form of a lot of acute symptoms in the form of breathlessness, severe aches and pains, incapacitated feeling, listlessness, not able to get up from the bed, severe weakness, loss of appetite, vomiting, or anything which is very serious and very incapacitating, get your markers done. Now, what are the COVID markers? The basic markers which is very useful is D-dimer, LDH, CRP, ferritin. These are more than enough. So these markers will tell you whether this disease is going multi-system or not, whether it's affecting your immune system or not. If you have these acute symptoms and also these markers are going high, especially D-dimer, start in blood thinner, and also this drug molnupiravir, which is a new salt. In many of my patients, it's finding a good place, and the symptoms recovery is faster. But again, my take-home message to most of the people, one doesn't need any kind of specific treatment unless and until there are serious symptoms, unless and until there are high inflammatory markers. So it's a boon for the society. This Omicron is acting as a vaccine virus, as a kind of vaccination for the society. I'm sure in a month or so, the whole community will be vaccinated and the world will accept COVID the way I've accepted the viruses. So don't get panicky, don't get disturbed, unnecessarily don't get hospitalized, don't fill up the ICU beds. And most of the people, you are all protected since you are vaccinated. You will not have any lethal symptoms. And unnecessarily don't get panicky for this booster dose. If you have got this virus in some form, you are protected. Regards, Dr. Bose.